you have a sentiment, particularly in the U.S. Congress, to some extent outside the U.S. Congress, that healthcare reform can't bust the deficit, that it has to pay for itself, that we have to find some way to finance it. On the other hand, everything that you put on the table that would finance it is going to bother somebody. The game with healthcare is finding that magic combination of ways to pay for healthcare that are just acceptable enough that you can get it through. I take what John is saying very seriously. I think you're right. I mean, in the ideal world, you wouldn't have to, from a political standpoint, putting aside the policy merits, from a political standpoint, it'd be great if you didn't have to sort of put this out there and risk alienating seniors. On the other hand, what are the alternatives? If we accept that McCain amendment, I guarantee you, you lose 10, 20 votes in the Senate because healthcare reform is no longer fiscally viable, and it's done. If you do it as a tax, that's not going to pass. Now, I'll tell you right out front, it's not my ideal way necessarily to finance this, although I think a lot of these changes will, in fact, make sense from a policy standpoint. But when you look at the options that are available for getting healthcare through, and you play this out not just for tomorrow, not just what's going to sound good in terms of a soundbite with Medicare, but going down the road of this debate when you have to get Ben Nelson's vote and you have to get the moderate Democrats or worse done, I think at the end of the day that when you consider the fact that you can sell this as being smart policy, that you can pull out of your pocket the endorsement of the AARP and the AMA, I think you can get by doing this politically. And even though it's not easy, I would argue it's actually easier, or more accurately, less difficult than the alternatives.